Now we're going to be talking about pharyngitis, or that common sore throat, which is inflammation of the pharyngeal mucous membranes, and it often occurs with rhinitis and with sinusitis. Acute rhinitis can be, acute pharyngitis, can be caused by bacteria, viruses, other organisms such in trauma, dehydration, irritants, tobacco, or alcohol use. A common bacterium causing pharyngitis is group A, beta hemolytic strep, but in most cases, adults are caused by a virus. The patient with pharyngitis usually has a sore throat and dryness, throat pain, pain on swallowing, which is also called odonophagia, difficulty swallowing, and fever. It's often difficult to distinguish on physical assessment which is viral and which is bacterial. It gives you a chart on page 643 regarding viral versus bacterial pharyngitis. The temperature in viral is usually low grade or no fever, whereas in bacteria we have a high temperature. We can also, in our throat manifestations, we'll have scant or no tonsillar exudate, slight redness of the pharynx and the tonsils. With our bacterial pharyngitis, we'll have severe hyperemia of the pharyngeal mucosa, tonsils, and the uvula, and we'll also have redness of the tonsils with yellow exudate. With the skin, usually have a no rash with the viral, and you may have a rash with the bacterial. Dysphagia, odonophagia are present in both. There's other symptoms that you may have, such as the rhinitis with the viral, mild hoarseness or headache. With the bacterial, you can add to the arthralgias and the myalgias, which makes you a lot sicker, and it's more of a systemic. On our CBC, on our viral, we'll usually our white blood cell count will be less than 10. And we'll have negative throat cultures as usually as a result. Usually there are a lot of false negative cultures that can occur, and it's important to know that, and know that 24 to 48 hours it usually takes to get the cultures back. So, and there is a certain way that you need to get that throat culture, and first you need to get the cotton swab from a throat culture kit, and then you take that swab and you take over the right tonsillar area, moving across the right arch, the uvula, and then across the left arch to the left tonsillar area. And you have to make sure that you don't touch the patient's teeth, tongues, or any gums, and make sure you place the swab back into the tube, crush the ampule, and make sure that you send it right away to the lab. With our bacterial pharyngitis, our CBC count is abnormal. We usually have a white blood cell count of greater than 12,000, and we have a positive strep result. Usually our onset for bacterial is very abrupt, where our viral is usually very gradual. So on our interventions, it's important to know that most sore throats in adults are viral. They do not require any kind of intervention. But the patient needs to rest, increase fluids, humidify the air, and use analgesics for pain. Gargling several times a day with warm saline, using throat lozenges are important as well. If the patient has been diagnosed with a bacterial pharyngitis caused by group A strep, you need to know that it can lead to serious complications such as acute glomerulonephritis, so it's going to attack the kidneys, or rheumatic fever, carditis. Usually that acute glomerulonephritis can occur about 7 to 10 days after the acute infection, and rheumatic fever may develop from 3 to 5 weeks after the acute infection. If the patient is on antibiotics for strep, the patient should be reevaluated if there's no improvement in 3 days. There is another rare complication of pharyngitis in adults, and it's called epiglottitis, where it basically the epiglottis can swell and obstruct the airway, causing an emergency situation that inhibits oxygenation and tissue perfusion. So it's important with your if a patient has pharyngitis, that if they develop stridor or any other indications of airway obstruction, it's very, very important that they call 911. Another symptom is, besides the difficulty breathing and stridor, is drooling. Is another one that they would look at, and that's an emergency situation. It's important to teach the patient to take his temperature every morning and evening until the infection resolves, and usually he's not contagious after 24 hours after antibiotic therapy. Okay, now we're going to be talking about tonsillitis. Tonsillitis is an inflammation and infection of the tonsils and the lymphatic tissues located on each side of the throat. The tonsils are that tissue that's shaped like small almonds, and they're often covered by mucous membranes and have small valleys, or what they call crypts, across their surface. And basically, tonsils, their function is to filter organisms and protect the respiratory tract from infection. Tonsillitis is a contagious airborne infection. Acute or chronic tonsillitis can occur in any age group. It's less common in adults. Usually lasts about 7 to 10 days, caused by a bacteria, most commonly strep. Other bacteria can include staph, H. influenza, and pneumococcus. And viruses can also cause tonsillitis. Chronic tonsillitis may result from an unresolved acute infection or recurrent infections. On page 644, chart 33-3, it gives you some key features of acute tonsillitis: sudden onset of a mild to severe sore throat, fever, muscle aches, chills, dysphagia, odonophagia, painful swallowing of food, pain in the ears, headache, anorexia, malaise, that hot potato type voice, thickened voice of poor quality. Tonsils usually swollen and red with pus. Tonsils may be covered with a white or a yellow exudate. Purulent drainage may be expressed by pressing a tonsil. Uvula usually is very swollen or inflamed, and the cervical lymph nodes are usually tender and enlarged. So basically, we do diagnostic testing often to rule out other causes of the sore throat and the fever. The rapid antigen test, CBC, throat culture, sensitivity studies, monospot, just to make sure that it's not mononucleosis. If there's any respiratory symptoms that are present, a chest x-ray may be needed. The WBC is usually elevated in bacterial infection and normal or low in viral infections. We're going to treat with antibiotics, usually penicillin, and if they're allergic to penicillin, azithromycin. Those are usually prescribed for 7 to 10 days. Of course, all the supportive care that we've been talking about to increase rest, increase fluid intake, humidify the air, use analgesics for pain, gargle several times a day, and use the throat lozenges. Surgical intervention for tonsillitis may be needed, especially for recurrent acute infections caused by strep. Chronic infections that do not respond to antibiotics, maybe if they have an abscess or enlarged tonsils or adenoids that may obstruct the area, then they may be candidates for surgery. I think that's it for that one. Okay, we're going to continue with laryngitis. This is inflammation of the mucous membranes lining the larynx, and it may or may not include swelling of the vocal cords. Usually laryngitis is seen with other manifestations of other problems such as throat or lung cancer. Common causes include exposure to those irritating inhalants, chemical fumes, tobacco, alcohol, smoke, any kind of voice overuse, inhalation of fumes, or fumes such as glue, paint, thinner, butane, or intubation can also cause laryngitis. Recurrent laryngitis may be also be caused by GERD, gastroesophageal reflux disease. You need to assess the patient for hoarseness, dry cough, difficulty swallowing, complete but temporary voice loss, aphonia may also occur. If there's any suspicious lesions, an x-ray, they'll do a CT. The nursing management focuses on symptom relief and prevention. Treatment consists of voice rest, steam inhalations, increased fluid intake, and throat lozenges. Antibiotic therapy and bronchodilators are prescribed, especially if there's also symptoms of sinusitis or bronchitis or any other type of bacterial infection is present. So we're going to teach the patient and family about relief measures, infection, prevention, avoidance of alcohol, tobacco, pollutants, anything that can irritate the larynx. And we want to teach about reducing tobacco and alcohol use, emphasize the need to avoid activities that place an added strain on the larynx, such as singing, cheering, any public speaking, heavy lifting, and whispering. Speech-language therapy is used when if there's any injury to the vocal cords, and further evaluation will be needed if there's any kind of recurrent bouts of laryngitis.